The number of coronavirus cases here in the U.S. now tops 1,000 as state officials take new steps to try to contain the outbreak. Anjalee Khemlani joins us now. Anjalee, good to see you here this morning. What's the latest on the coronavirus updates?
So we know that the case count continues to increase, and it's really increasing a lot. So yesterday we ended the day at around 116,000. Already today we're over 121,000 cases worldwide. So we're really seeing that growth. That's probably a result of more countries reporting and us testing more, which is what was expected, right? So we know that that's happening. Meanwhile, the death toll, unfortunately, is now over 4,300, and that continues to climb. And we know that, as we saw in China and South Korea, and as well as Italy, the deaths are overwhelmingly affecting older than 60, and we've been keeping an eye on what's going on in Washington State with the nursing home in Kirkland that really started this whole concern for the outbreak. So really waiting to see just how the response continues. We know that there have been reports about issues with the testing and whether or not they can get out in time, what the turnaround time is, and how that plays a role in how well we can keep track. Meanwhile, yesterday in New Rochelle, of course, setting up that 1 mile containment zone is probably the first action like that in the U.S. that we're taking. So really looking to see how that plays out as well, as we continue to see what the right response is and what the federal government is doing to help with this outbreak.
Yeah, the government bringing in the National Guard there for that containment center in New Rochelle. You're talking about the deaths happening in mostly 60 and up with people with underlying medical conditions like diabetes. But I want to talk to you about the testing, because there's a report out today that's really quite troubling, and it shows that we are woefully behind as a country when it comes to testing. Apparently, we have tested 5 corona tests per million people. Compare that to, say, South Korea, 3,700 tests per million people. Where do things stand right now with the testing in this country? So right now what happened was Politico actually reported yesterday that the CDC has noted that there is a shortage of a sort of like a mechanism for that test. So you have to remove an RNA strand in order to test right from the swabs. And so that is missing. And so that plays a role in just how well, the coordination efforts are. And so we really do have to see. No reports on what is going on with the commercial tests right now. We know, of course, Quest and LabCorp did, roll out theirs starting this week. So, time will tell. We'll just have to keep watching and waiting. All right, Anjalee Khemlani, thanks for the update. Of course.
Hey, investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.